Can I say thank you too for inviting me back again to talk about what the last year has been like. It's, remember, not only ME that I'm interested in, there's muscular dystrophy and about 22 other conditions as well, where we, those of us who are interested in health, try to take up the issues and encourage people and stimulate them to interact with the parliamentary political process to make things better, to get it noticed and so on. I think to a large extent we have done that. We've got it noticed, but we've a long way to go yet before we stimulate the kind of activities that we actually want to see, and I'll say something about that later on. So thank you very much for all the work you've done, and thank you to all of you who came along and told us. Thank you to all the kind people who gave me a good shouting and, gubbing, as we say in Scotland, about some of the stuff in the report. And remember, it was a report produced by a committee, so in that sense, there were some real arguments, I can tell you. I'm never going to write down who fought with who and so on, but if you look at the members there, you will see they have very different views about ME. The reason, as I said last year, I took the whole position on ME up was against better advice. People said, don't touch it with a barge pole, was what was said. It's you're just going to get battered from limb to limb. But saying that to me is, the red rag to the bull, so off we went. And I think in a year, 2 years, I've found out a lot about the condition and certainly met with lots of groups and do understand some of the differences of opinion that pervade the community. And I think that's my theme. I think we should see ourselves as a community, and this conference is a perfect example of that, where people can come together and argue together, discuss things together, and come out with some determination to do something about it, because that's what really stimulated me. When I heard from some constituents about ME, I don't know why I reacted the way I did, but they were good advocates, certainly, but there's a real problem in ME, getting to the basis of it and getting it taken up. It's no use just sitting back and say, oh, we don't understand it, it's too difficult and so on. Just leave it. That is no good. And I think that's what stimulated me to try and get inside the whole problem and see what we could do about it. And we took evidence. Now, kindly, the chair has said we had trouble. I mean, we weren't an official committee to the extent that we were set up by Parliament with about 22 clerks and so on, like a select committee and so on. And in some ways, I'm glad of that, because you can make the roles up as you go along. You can have the people in that you want to see and so on. On the other hand, you don't have the kind of help that you need to produce the reports, the minutes, and some of you will know that the young man who had worked with the all-party group, who helped us for the first part, left for another job halfway through. And I had to turn my staff over to helping out, taking minutes and doing the best they could from a zero position. It's not really on their job description, but MPs are probably the worst employers in the country in terms of giving jobs. And I want to say thanks to my staff, Sarah Vero, who some of you have talked to and who continues to take an interest in this area, and I'll say something about what we're going to do later on, and Hugh and Lee, who worked before her. And they did a great job, and if it's difficult for me, it's certainly very difficult for people from outside to understand what's going on. So there we are, we started it off, and it was, to me, something that I thought Parliament really ought to engage with much more importantly than it does. Not just because of the number of people who are involved with ME and suffer from it, and the real seriousness of the illness. And I really must say, some of the attitudes I got really made me fighting mad. GPs telling me there's no such thing, it's all in the mind and so on. It's still there, still there. Amongst MPs who are GPs, I got that too. Why are you bothering with this? It's just nonsense. People make it up. Well, I do get angry when people say that, because if you have constituents, if you meet people, you know that that's just nonsense, and it's just, people hiding it with their heads in the sand and not trying to address the problems. So I was very interested in going with this, and we got our committee together, and they attended very well. Now, you remember that it was only my personal muscle that got people to come on that committee, people who were fairly knowledgeable and some not so knowledgeable, but interested, who came along and I think attended rather well the sessions. It's very difficult to get them now to take an interest because they've moved on to other things in their heads. But we are planning to have another meeting next week, because I do hold my hand up and say, yes, there were debates and difficulties in getting agreement. In fact, and the committee nearly split at one point because of the arguments, but I managed to keep them together. And some of the things that are in that report don't satisfy everybody. I know that, and we will be trying to move to get a final wording on some of these conditions, for example, children and so on. I do appreciate that, but I just hold my hand up and say it was very difficult to get agreement on that committee about these issues. And what came out of the report, more than anything else, I think, was what we don't know and what we do need to find out, and about the stigma and bias that professionals have about determining what the causal nature of ME is, and so on. So I think that was a real lesson in terms of the folks who were on the committee, and I think they feel battered and bruised too. But then they're politicians, and that's what they get paid for, being battered and bruised. And they managed to hold it together. But we'll have them once more to try and make sure the whole thing gets tied up in relation to all the comments that we've had from yourself. Right. I said something about the problems, but let me just say one or two other things. We had lots of patients who came to see us too, who came past my office, both here and in Norwich, to talk about the condition, and they wrote, and we really did get good, I think, good hard information without having the deep understanding of what all the problems were. We certainly came a long way to finding out what the problems might be. But let me just talk then basically about what we concluded. First of all, the research in this area needs to be really revamped, and more money. I think we called for £2 million. I hold my hand up again. It could be £5 million. When I see where some of the money goes in IT programs in government, I'm never going to be ashamed asking for millions of pounds in terms of, helping people who certainly need that kind of help. We've identified the need for diagnostic tests, viral, infective causes, and so on. We really do need to have solid research in that area, because if we can get some good answers, research always, it doesn't give you 100% answers, but it takes you a long way to beginning to understand, what the nature and causes of illnesses and diseases are. We didn't actually say, as others have said, that we like the biosocial model and all that stuff. We certainly did not. I think everybody on our committee thought that a biomedical approach to the problem was much more, in tune with what we should be doing in terms of research and so on. We were quite determined about that, and we could see the bias that there was in the media and also, of course, in higher places in government about the causes of ME. We wanted new diagnostic criteria as well, and you'll see in our report we came down with we're rather being taken with the Canadian criteria, for example. Not everybody is, but we were. We liked the way it was spelled out. And Dr. Byron Hyde has now come out with a new Nightingale definition after I challenged him. It's comprehensive analysis of symptoms and so on with ME. And I hope that the report stimulated him to go ahead and keep researching the field. There's many fields of medicine that we want to get involved in. We want immunologists involved in it. We want endocrinologists. We want neurologists in it as well, and to get hold of that evidence and so on. And what we've been trying to do now is get all the people who do the research in this field together to get, perhaps at the end of the rainbow, a centre to do the research, who knows, but certainly to get them together to apply for money, using the argument that we have about the biomedical evidence being necessary, planning the experiments, doing the research, and getting that forced through and getting the money to actually do that. And I think people are beginning to think how that can be done. Now, I think you have a part to play in that as well, because I think getting the evidence is going to be very, very important in this field, not just early diagnosis, but also the causes of it and so on, so that many of the arguments will be decided. Now, I'm not saying there's going to be one answer necessarily. It may be much more complex than we know, but without the research, how do we know? We can have fights about it and so on, but we do need to plan experiments, and there are people in this room today who we've talked to about getting together. And I'll say what the official response that we've had from the government. We have talked, for example, to the Medical Research Council, who are about to get a new chief executive. And although they say they give money to research, it was very funny during the inquiry when we asked the minister, he's still a Minister of Health, you know, why the biomedical model isn't researched and more money put into that. And he said, we don't get grant requests in that area. Well, you know, somebody told him that, you know, because it's not true. They do. It's just that they throw them in the bin, actually. I think it's as crude as that. And I think that we need to do much, much more there in terms of making sure that they're properly assessed, grant requests like this, and not biased in terms of the funding and so on. We've talked to Sir Liam Donaldson about it, the Chief Medical Officer, who's very sympathetic. After all, there was a Donaldson report, and not a lot has happened since his report came out and so on. And we're talking to him about getting some activity going now, not only in the field of research, but in actual looking at the treatments that might be available as well. MRC, I think, are holding fire at the minute till they get the new chief executive in. It'll be towards the end of this year, and we'll be knocking on that door, hopefully with a grant request very quickly to make sure that some money comes the way of doing this research. I have been involved in eating disorders from the Beat it's called now, it's Beating Eating Disorders. And after we had a debate and arguments and meetings and so on, we managed to get £2 or £3 million into the kitty for them to do research and so on, again, with some clinical psychiatrists. I don't want to talk about clinical psychiatrists because I've been involved in the mental health bill all week, talking about the issues around there. And clinical psychiatry comes up all the time. And we find that there are other people involved in looking after patients, nurses, carers, and so on, who we think have equal rights to say important things about bettering people's health and so on. And there's been a bit of an argument between the parties. Some who think that the doctor is omnipotent at the end of the day legally. Perhaps they have to do the final thing. But the evidence must come from everybody who's involved in the care of the patient and so on. And we find that too, of course, at ME. There are many individuals involved with the development and improvements in people's health where they take place. So we're going to be talking again to Liam Donaldson and the MRC, and the aim will be to push for grant money to do the research. And we're talking to the Department of Health, who, funnily enough, keep losing our letters and our requests. Yeah? You'll know that yourselves, you know. We get the same thing. We've written twice about it. So personally, it's going to be delivered to whoever the minister is next week. It's a bit rocky just now who the minister might be on this issue. So I think, you know, it's very slow in terms of getting all this going and getting the kind of changes that you want as well, the amendments that we're going to do hopefully next week when we get the committee together. And I think, too, that it's going to be difficult to keep that committee going. In fact, it's going to be impossible because it was a one-off inquiry to try and get the thing raised. And we did get some media coverage, not enough, I might add, although there was a woman, Mail and Sunday, I think, picked it up because my wife shouted me, "Oh, you're famous, you're in the Mail and Sunday." It was in, I think, the magazine section there. And she came, I think, to our hearing when we were talking about how we got the money together, what kind of research we might do, and so on. So we have got some media support who want stories, and we will use that where it's necessary. So we've raised it to that extent that people know there are people who are interested and have got stories to tell. So I think, too, that we have been looking at these centres, which you were so kind about recently. I'm involved in trying to help save one in the East Anglia region at the minute, and I've got the Strategic Health Authority, hopefully, coming to meet the group from Norwich and Cambridge and so on to talk about that centre and keeping it going. Because I think with the PCTs and the health service being in the state they are at the minute, I guess I know which services are going to be destroyed first, and I would imagine that centre might just suddenly disappear. After all, the consultant, I believe, is retiring, and we've got to make sure that we have some eminent figures who will come, and I believe there are people interested, and probably in the audience here, that are going to help keep that centre going. So it's going to be a continual fight there as well. It's a continual fight about benefits too. We've talked to the DWP about it, and others of you are doing that too, making sure that, that the condition is just equivalent to many other illnesses that seem to feature very large in the DWP policy and so on when they talk about benefits for this, that or the other. We've got to make sure that ME doesn't disappear off the agenda in all the government departments. I've told you something which we're trying to do in health, in the Department of Health. But I wanted to finish really on this note. You're a magnificent team of people, actually. Now, I've got scars on my back, as you know. There are always people who are going to knock you whatever you do, and I was warned that would happen. And as a politician, you have to be big and brave and bold in this world to take it. And, of course, some of their complaints and their points are correct. But I tell you this, our strength is where we work together. I think the community is so important. It's nice to see people from many different groups in the same room, prepared to do something with the same end in view. Sometimes the community, it makes people throw their hands up. I mentioned at the beginning how MPs said, oh, gosh, you won't get anywhere. They're always fighting and squabbling. So it is not true. The majority of people have said to us, there may be flaws in parts of your report and so on, but thank you very, very much for trying. Keep going, and we will do that through the all-party group and so on now. Keep stimulating them to get active, get MPs involved, members of the Lords and so on. I just want to finish by saying thank you very much for giving me a real chance to look into something and hopefully to make just a slight difference. And next year, the Minister of Health, presumably, will be queuing up to get in here to tell you that there's going to be millions. So that's our aim. Thank you very much.